one is entering, but I'm asking about the regional hospital in Galway, the University Hospital, and a master plan that we're waiting on for a long time, and a controlled development plan. And I have in my hand the HECRA report from their last unannounced visit, and there's a shortage of 232 beds, a huge difficulty in treating patients with dignity and respect, privacy, notwithstanding the improvements that have been made and good comments from the patients. We're talking about a hospital that's under serious pressure. So if you could give me an update, please.
I thank the Deputy for her question, and it's timely as I'm visiting Galway University Hospital on Thursday, as it happens. And of course the Deputy is aware of proposals for further significant capital investment there. That includes additional bed capacity, new emergency department, new paediatric and maternity facilities, new helipad, replacement laboratories and a cancer centre at University Hospital Galway. At Merlin Park, a surgical hub is under construction and plans for the new elective hospital are progressing. Due to the scale and complexity of those projects, a programmatic approach is necessary to ensure the continued delivery of care on the congested hospital campus, and we couldn't deliver it all at once on one site, and so that master plan to move around is important. The GUH Capital Programme Oversight Board has developed an integrated strategic master plan for UHG by way of the Campus Development Control Plan, the DCP. That master planning process, informed by population health needs and regional clinical demand, will, as the Deputy is aware, provide a clear plan for the sequencing and delivery of the new capacity and facilities. Both the DCP and the Programme Strategic Assessment Report are currently being finalised by the HSE. I understand that this is to be presented to the HSE Board for approval at the end of this month. We expect that it will be then submitted to the Department next month for review in line with the infrastructure guidelines. And the HSE has advised that initial enabling works to support that programme of work has already begun, as I imagine the Deputy is already aware.
And unfortunately, I won't be there at that photo opportunity on Thursday because the Dáil will still be sitting. No, I welcome that you're going to Galway. But just why I put my hands up is we had the former Taoiseach back in 2017 telling us it wasn't fit for purpose. It's now, what, 2025. And look, I'm looking at HECRA from last year. A strategic assessment preliminary business case has been completed, approved by the Health Executive Board and submitted to the Department of Health. Now, so forgive me if I'm a little frustrated. I was born, bred and reared in Galway, in and out of that hospital for many reasons. I know it on every level, professionally and personally. It's not fit for purpose for a very long time. What you're reading out to me, I appreciate there your answers. I have them all of those answers I'm getting. So hopefully when you're down on Thursday, you will find out which plan has been completed and why I've been told that this one was done last year by HECRA. That was their answer to HECRA. Okay, I won't go over time. I'll stop under time, actually.
Deputy, I appreciate your frustration. I appreciate that there needs to be a major plan. I appreciate that this has to be done in a sequencing way so that the hospital can continue to function. The information that I have for the Deputy is that it will be presented to the HSE Board for approval at the end of this month. I cannot put it further than that. I am attending the hospital, as I attend many hospitals, not to take photographs, but to visit and to speak with management, to understand better the hospitals and how they work, the local nuances that impact them, the fact that Galway has been in difficulties over the bank holiday weekends. I want to understand the scheduling, the roster, quite apart from capacity issues. What is happening with the rostering of the public-only consultant contracts? What is happening? Are there local issues that explain the particular difficulties that they've had over the weekends? I'm not interested in photographs, but I do have to do my work. It's not the first time I've heard it, but I appreciate your perspective on it, but I do plan to go anyway.
Deputy Conlon.
I welcome that you're going there, but I welcome. But listen to what I'm saying. Back in 2015, it wasn't fit for purpose. We had Leo Varadkar down there telling us it wasn't fit for purpose. We had Micheál Martin, and here we are in 2025, and we're getting more and more plans. I welcome that there's something at the end of this month. We have 31 people in there with nowhere to go, delayed discharges. We have a serious problem with privacy and dignity. We have a problem with lack of staff. We have a problem with lack of clinical leads. Notwithstanding the progress, I pay tribute to the staff. Let's go back to Savita Halappanavar 2012 and forward. And this is a hospital seriously under pressure, a congested site, not enough staff, not enough beds, 232 beds by their own press release they're short. I pay tribute to the staff. What I don't pay tribute to is all of the governments that have let this happen. There was an options appraisal way back where the hospital was to move to Merlin Park, and I foolishly relaxed thinking we were getting a brand new hospital. Now, for the last 5 years, we've got a jigsaw approach to this, and finally we're hearing out about a master plan, but there's no sign of it. Garma.
Deputy, I appreciate that you're raising this for many years, and I appreciate the reasons for that, and I have huge respect for that. This is the programme that this is the approach that has been taken. From my perspective as Minister, I will be keen to see this move forward as quickly as possible once it's within my control. I am concerned about the interaction with the infrastructure guidelines and the revision process that's ongoing there with the Department of Public Expenditure and Reform to make sure that the delivery of these projects is done as quickly as possible. The question about whether, for example, you need 4 business cases or do you need 2 business cases, or as you say, when so much work has gone into it already, to be further delayed by infrastructure guidelines such as they are would not be acceptable, and that is a body of work that I can take responsibility for, interacting with the Department of Public Expenditure and Reform, and also the speed with which it moves in relation to my own department. But I do have very strong respect for the background work that you have done, the way in which you've advocated for this month after month after month in this House when you've been a member, and I understand the reasons for that, and I look forward to going on Thursday to see for myself.